Ladies and gentlemen, welcome back
Woohoo!
to the Dr. Burchett Show. This is our dermatology series with dermatologist Dr. Jennifer Sbicca. I'm an ER doctor, family doctor trained. Today, we're going to talk more about separating fact from fiction, the real deal expert from the snake oil salesman or the uncredible blogger.
Yes, there are a lot of uncredible bloggers.
I don't know if that's a word, but I made it up. So we're going to talk. What are we talking about today?
Today is sun protection, which I love. Sun protection.
Lame.
No, sun protection is so interesting
No.
and so important. By the end of
Why
this,
is it-
you guys will love it too.
Why is it important? Like, I feel like it's a pain in the ass to put on sunscreen. Like, I'm just going to be honest.
Everyone doesn't like to put on sunscreen. It's true, but it's important for two reasons. One, no one wants cancer. Two,
I do not want to die of cancer. I've
No.
seen some awful, nasty, like, growing things.
Yes.
And people have lost, like, part of their face.
oh yeah,
Some people die from skin cancer.
Oh, yeah.
It's like, and then melanoma is such a nightmare.
it's such a nightmare.
Like, you can get treated and you're fine, and like 10 or 15 later, and then you just, I almost said that, and you die.
Yeah.
Melanoma's awful.
Yeah, so it's good.
So that's kind of a big
important
deal.
for that. But also, everyone wants to look good as long as we can. And so it's also important just for vanity and preventing age-related changes on our face.
So wait a minute. I might want to look good.
Yeah, that's right. Now you're listening.
So what do I have to do to look good?
So the number one thing, we'll have the three things. Number one is try to be in the sun. Avoid the sun if you can.
Avoid the sun.
Wear a hat, make sure it's got a wide brim so it covers your ears and your neck. Use a shirt, stand under a shade. 10 to 2 are the major peak hours for sun exposure. Try and stay out of the sun during those times.
I
too.
wouldn't say like base your life
No.
around these recommendations.
Live your
but-
life. Still
but
go to
be
the beach.
conscious of
Bring
them.
an umbrella.
And yeah, totally. Things
Yeah.
like that. Or they make these swimsuits that have the sunscreen.
Yeah, they do.
You
Yeah.
know, like sleeves and legs.
You can wear
and
those.
We
Yeah.
love using those for the kids.
Yeah,
You know, because then you
exactly.
don't have to worry about lathering up the whole thing.
Yes. And the number one cause of melanoma, like you mentioned,
Yeah.
there's some evidence that it is light related, some evidence that it's not light related. But the evidence shows that it's blistering, very bad sunburns when you're a kid is the number one risk factor.
What do you
for
mean,
melanoma.
light related or not light related?
So, you know,
you
like
mean sunlight?
sunlight related.
Like
sun.
the total amount of sun exposure over your life or something?
So it's
or
not
like,
related to that usually. Usually it's very bad sunburns when you're a kid.
So if you got burned a lot when you were a kid, you're at
Yeah.
high risk for this awful, deadly disease.
Yeah, so it's really important to keep your kids sun protected when they go to the beach. Those bathing suits
So
are great.
don't let your kids get burned
Yeah.
to prevent melanoma.
Yeah.
Speaking of the kids, I put sunscreen on Ellie, my 6-year-old daughter, the other day,
Yes.
and we like lathered, but she still got burned.
What time did you put the sunscreen on?
Well, like when we got there, I don't know, early.
And what time did you leave the beach?
It wasn't the beach; it was a pool, but later,
Later.
like hours. We were there all day.
Hours. Yeah, that's the other number two thing.
So this is tip
And
number two.
You have to reapply. Sunscreen only lasts for 2 hours.
What?
Yes. You have to I know everyone is shocked when they hear this, but it is. You see it on the thing. 80 minutes. There's only 40 minutes or 80 minutes. So 2 hours is a stretch.
That's ridiculous.
I'm giving you some extra time.
That
for
is
2 hours.
2 hours is ridiculous.
Yes.
Like 4 hours is a pain.
Yeah, and especially if they're in the water, maybe even a little more.
Like
Like
every time they get out of the water,
you could do every.
you are
hour
totally
and a
going to
half.
be one of those like crazy moms chasing the kid around with the sunscreen. Like, Mom, stop!
I have been known to have, you know, those carabiners when you do rock climbing. I've had the carabined sunscreen
Come here,
on my
Joshy.
bikini. Yeah, so reapply a lot, and then if you're going to be out, you know, doing water activities or going to be outside doing sports, you're going to be sweating. You want to make sure it says water resistant. 80 minutes is the max you can do. When they do the testing for sunscreens, what they do for the water resistant is they put you in a whirl tub bath for 20 minutes 4 times to get the 80-minute resistant.
Oh.
Yeah.
Huh.
So they've actually
Interesting.
tested it.
That's interesting.
Yeah.
I'm like thinking about this, and I'll be honest, like part of me is just like, forget it, I don't care that much about it. Like I'll put it on a little bit, and if I sweat it off, fine, big deal. But then like, do I want to
Vanity.
look like a
Yeah.
wrinkly old
Vanity
dude?
falls. Yeah.
Like if you're really serious about that, then
If there's
slap it on and
one thing you can do to look better, wear sunscreen every day. The third thing is what number. People always ask me what number should I wear.
tip number 3, What SPF do you need to do? What do you think? What would you guess SPF like minimum to get the benefits of blocking sun and preventing cancer and wrinkles and all that?
A lot of women think 15 because 15 is the most common in our face makeup, but you really actually need 30. 15 is not going to cut it.
15 is not good enough, but 30 is good
30
enough.
is good enough, broad spectrum. And then people always ask about SPF.
What about 100?
Yeah, 90.
What if I put on like
or 100
90?
or 70?
If I put on 90 once, can I get away with it and I don't have to reapply?
No, you always have to reapply every 2 hours. And 90 doesn't really matter. I would say don't go for 90. Go for 30 or above. The higher it is, doesn't really matter how much protection.
So
you're
like
getting.
30 and 50 and 60, you'd say
They're
like,
about the same.
they're kind of the same.
Yeah.
It's like one of these things where it like peaks. You know,
Yes.
it's like, it just doesn't get better as it gets.
Yeah.
Well, like I think one of the things, I think everybody wants to look younger and look better and not get wrinkly and old and look old and all that stuff. But there's another element of beauty in our culture that we're fighting against, and that is tan.
Yes.
Like we've kind of been sold that it's pretty,
We have
it's
been
beautiful to
completely
be
sold.
tan, and so that's I think at odds with
It is.
if you want to be pretty. Well, do I want to be tan or do I want to be wrinkled? You know what I mean? Like there's
And
those.
people say that you need both to be beautiful, but it's funny. Tanning has not always been a measure of beauty in the world, and certainly even currently in our current day is not a measure of beauty. Most Asian cultures do not see tan as beautiful. Usually, most of the
That's funny. I've
Anglo-Saxon
heard
and
they
white,
want to be more white.
Yes, pale and a little pink is the skin of beauty in most traditional Asian cultures. But for white people, especially in America with our glorification of beach culture, it's the tan. It's really interesting when looking back at when tan became popular.
When did tanning become popular?
Yeah, if you go to a museum and you look at the beautiful people in oil paintings from 1600s, 1700s, most of them are all pale. Because being pale meant you weren't a day laborer, you weren't outside, you had a life of luxury, you were inside. And so it was really actually...
Clearly what my pale skin means. Life of luxury in the hospital.
You actually probably should be getting pretty pale. You spend a lot of time in the hospital these days.
Vitamin D deficiency.
Yes. Coco Chanel is credited for making tanning popular. and
Coco
sexy.
Chanel,
That's the Parisian,
fragrance, the beauty
house-
line.
Yeah, well, she's had a whole design line.
Oh, the
Coco
person.
Chanel. The person, Coco Chanel.
What did she do and when?
So around the 1920s, she started marketing tan as...
Wait a minute, is she still alive?
She's not still alive.
Oh, okay.
No.
It's like, wow.
But that was
She looks amazing.
She's tanned a lot, so she probably doesn't look that amazing.
Yeah,
But-
well, she probably got a little work done.
But she started selling beach culture that people can afford vacations as luxury, and that luxury became sexy. When you have money to go on a vacation, you go to the beach, you lay out, you get tan, and that became seen as
Part of her brand.
as expensive and part of having an expensive.
Wow,
luxurious
that's crazy. So
lifestyle.
she pushed that, and we bought it.
We bought it, and everyone else bought it, and so since 1920s-ish, tan has become sexy again in America.
That's interesting.
And among the Anglo-Saxon kind of
We could talk a lot about that.
genre.
And you said this to me that struck me once, because I was like, I want to go get tan as quick as possible, but I don't want to burn, and I don't want to be bad to my skin. You're like, no, that's unhealthy.
Yeah, tanning is unhealthy. Tanning beds are unhealthy. Tanning beds are the worst because they're UVA. I would say A is for aging and B is for burning. UVA produces all the skin age-related changes that we see on the
Cancer,
face. Not cancer. That's UVB, burning.
B, burning, cancer.
Yeah, UVB makes you burn. UVA
A,
is
aging, B.
aging.
That's good. I always get those confused.
Yeah.
You know what the difference
Yeah,
is.
and our cars do not protect us. The windows do not protect us from UVA.
You are
That's-
just full of information. I'm
UVB.
feeling a little overloaded. Can we go back to the part where tanning is not healthy? I really like this because I'm getting older. I'm not I actually am getting to a point where that's why I wrote the book, The Gentleman's Style,
Yeah,
because
you're
I was
interested in
ready
health and-
to actually take care of myself. And so now I'm thinking, wow, being tan
Yeah.
is not healthy, even though it
Yeah.
looks good.
We've talked about your redneck.
Or what?
Larry's got a bit of a redneck called chicken neck.
Wait a minute. Really? You didn't bring that up?
Yeah, the redneck. I'm
What?
calling you a redneck. See this change here? Oh, this is perfect. This red kind of plucked chicken looking skin is sun damage. And see how Larry's t-shirt line stopped. So the skin here looks much healthier. But here, these are chronic age changes. And sunscreen prevents that. It's called poikiloderma. It's a mixture of atrophy.
She comes up to me, and I don't remember what she was talking about. She's like, "You've got atrophic poikiloderma." I'm like, "What the hell is that?" She's like, "You're a redneck." I said, Excuse me? I know I'm from Kansas, but what did you just call me? Like, I think I'm a pretty with it time. He said, "No, you're a redneck."
Well, we can change
The
it.
show is over now.
I'll give you a free laser treatment, little Lair.
What can you do for redneck? We're gonna wrap this one up. We're about done.
Okay.
Let's talk about
The
what are the 3 tips. Are number 1. I always like to see if I remember these or not. I think I'm remembering them backwards.
One was
No. I got it. Number 1 is sunscreen. Avoid. There was the SPF one. The avoid the sunscreen.
Just don't go out. Just stay
Avoid.
Avoid.
Okay, number 1 was avoid or wear a hat
Yeah.
or clothes or sunscreen clothes.
Especially for your kids.
2 was SPF.
SPF over 30. Broad spectrum.
SPF over 30, and 3. I forgot 3. What was 3? You forgot 3
I
too.
forgot 3.
No, we had 3.
We had 3.
It was reapply every 2 hours.
I don't think we had covered that yet.
Yeah, we
had
did,
covered
because
a
I
little
talked
bit.
about.
Yeah,
remember,
we
I
did.
talked about how
That was number
Ellie got
2.
burned. And
That was
no,
number
we
2.
totally talked about.
Yeah, you're right. We did. But
Okay,
reapply every
SPF
2
30.
hours, even though you don't
Apply
want to.
every 2 hours, even though it's pain, because
Yeah.
you don't want the wrinkles and the age
And
or
the
the cancer.
cancer.
And 3, just try to stay out of it if you can.
Yeah. Don't go to the beach and bake. Bring an umbrella. Wear a hat.
That is the cornerstone of. So this is another thing I think is really interesting. Then we'll wrap this up. I can't stop talking. All of this anti-aging stuff out there, I think so much of it is bullshit because most of it, what do we say, 90% of wrinkles come from the sun?
Yeah, just wear your sunscreen. You won't have to go buy
Just
any of that
wear
stuff.
your sunscreen,
You will
and then
look so
all that
much better.
crap that they sell you.
Brown spots, wrinkles. The sun causes it all.
It's really just about sunscreen. That's what you get here at the Dr. Burchett
Yeah.
show.
I
That's
always
it.
tell
That's the real deal.
people say, "Oh, I don't get a lot of sun," and then I have them lift up their shirt and compare their arm to their belly, and I say, "That's your normal skin color." And
Let
it's
me-
milky white and clear, and here we have all the dark aging spots.
my abs here a little bit.
See, that's your normal skin color. And look at all these brown spots you have on your arm.
They're freckles. I have British skin.
Caused by the sun. There's no freckles on your abdomen.
Yeah, there are.
That's a mole.
Okay, all right.
That's a mole. These are sunspots.